Jolene, the V Movement is so honored to have you here. So tell us a little bit about everything. So we know that you are a fabulous nurse practitioner and now specializing in women's health.
I am. Let's see, I have 16 years of registered nursing experience, always been in women's health, and I've specialized in women's health as a nurse practitioner, and I'm loving it. But what I'm loving most about it is learning more and more about menopause and perimenopause because I'm of the age group, and I just want to explore it more and help the people in my community.
But it's even bigger than that because there's millions and millions of women that fall into this category, this age range. And the truth is that people aren't talking about it nearly enough. And a lot of our medical providers are not talking about it nearly enough. So, hey, you, that's why we're here. So give us a scoop. What is natural menopause?
So natural menopause is just something that every woman and trans man will go through. And it doesn't need to be scary. It doesn't need to be, oh my gosh, I'm getting old. It should be, oh my gosh, this is a new phase in my life. So when we're thinking about menopause, we know that it's a spontaneous thing. Our ovaries are starting to, the minute we're born, even before, our ovaries are already starting to lose our eggs. And so just, it's a natural process. We're just losing our eggs. And that's okay. It's okay. We know that at the end of menopause, so at the start of menopause, sorry, we will start to notice these changes. And usually these changes happen around age 35, maybe 40, and could go on until the age 60. We don't really know. But how you know that you are starting this transition of this decline of your ovaries, of your eggs slowly going away is your body will tell you. And it'll be simple changes.
Just like what kind of simple changes? Because
Simple,
we know like the red flags.
the red flags. So always, if you notice any change in your body, you're going to want to go see your primary care provider or hopefully a women's health nurse practitioner.
Yeah.
Some changes that you all notice, you'll just start having that irregular period. And some people, if you've had a regular period, you'll start to notice maybe your period will be longer. Maybe your period will be heavier. Maybe you'll go, instead of going 30 days, you might go 40 days. You might bleed instead of 3 days, you might bleed for 10 days. And just this shift of your period, that would be like one of the basic, normal, totally something that you'd want to notice. Some other changes, maybe some mood changes. Maybe you're starting to get a little irritated more than usual. You might notice some sleep disturbances, like all of a sudden you're like not having a hard time falling asleep, or you're having a hard time waking up, or you're waking up out of your sleep and all of a sudden you're like, I can't go back to sleep, it's 3 a.m. You might notice the common, everybody says, oh, hot flashes or night sweats. Those could also be something. You might notice some new vagina labial irritation. You might notice that your body is becoming more dry. Like your eyes will start to dry. You'll notice you might be having a little painful sex. You might notice some urinary dribble or just some urinary irritation. Basically, hormonal changes, any bodily function you might notice. But some women might not notice at all. And some women you will just go and you will go through menopause and you'll just be over and done with it. Some of us will have severe symptoms that we can't even control ourselves and we just need help.
I also noticed some little known things. Has anyone had where the deodorant stops working? Yeah. I've tried 50 different kinds. They still don't work. It cracks me up. I'm like, oh, I gotta try something else. Also, hormones, acne. It's really real. It's really real.
Every body function is going to start changing.
And I laugh because personally, is it because I'm postpartum 20 months and stopped breastfeeding a couple months ago? Or is it because perimenopause? Or is it both?
Or is it something else, some underlying diagnosis we don't know?
Gosh, it's so complicated.
It's so complicated and it's unclear. Yeah. But what we do know is that if you are in this age group of 35 plus and you're having some different changes, physical changes in your body, talk to your provider. Tell us how you feel. Tell us, is this affecting your quality of life? And if it is, then let's do something about it.
That's the key.
That's the key. And I believe that a lot of providers are not wanting to say that it is menopause. And a lot of providers just are uncomfortable with the topic and unfamiliar with the topic and are stuck back in our old studies of saying that, well, women don't feel menopause and that hormones are bad. Hormones are good.
Oh gosh, we need them. We need them. And I think a lot of people, the misconception is, well, my periods are totally normal, so I must not be in menopause. And the truth is that's not always the case. It can change, but all these other symptoms can still be happening, and you can still be in perimenopause and having some of these changes going on.
And as long as those changes don't bother you, then that's cool. Then you just keep living your life.
Yeah.
But if they're starting to bother you and you're starting to just notice different things, you definitely want to talk to somebody, provider, and figure out what's going on. We want to rule out any possible disease that you might have.
Right.
And it might be something simple, but it might not be. We recommend women's health nurse practitioners, and I believe ACOG, we recommend that you come to see us at least once a year.
Right.
Whether you're sick or not, you just come and have a chit chat.
It's like a well child check. So talking about all those pesky, fabulous, annoying, beautiful hormones, what you got?
What do we got?
Estrogen. Let's start with the big E.
The big E. So from my understanding of estrogen is that it's a basic life force for all women and trans men. However, estrogen can be a problem, but we're just talking about normal, healthy women and trans men. So estrogen helps all of our tissue in our body. It helps make sure that our vagina doesn't become atrophied and the lining stays nice and plump. It makes sure that we have plenty of lubrication. It makes sure that our urethras aren't irritated and can cause us to have urinary tract infections and frequent yeast infections. Estrogen helps our cheekbones and our beautiful heart-shaped face as being young and beautiful. Mm-hmm. And as we start to lose that estrogen, as we start to age, our collagen and our structure and our face change. We start to notice that belly fat, good God, in the squiggly teacher arm. And it doesn't matter if you're exercising or not. It feels like you're just all of a sudden, your body composition is changing. And it is. And, GI tract. So
big time on the GI.
It helps with our GI tract. I mean, it helps with everything. It's like estrogen is part of us. It's what our body starts to make as we go into our puberty. And like we have it until 30s, and all of a sudden it starts to decline and we start to notice those changes. Yeah. Brain fog and early signs of dementia.
Yeah.
Heart palpitations.
Yep.
Like all these things that can potentially happen. And it's because our estrogen is going away. And the main part of our estrogen is in our ovaries. And our ovaries are just, our brain's telling our ovaries, hey, produce that estrogen. But our ovaries are saying,
I think we're out.
I think we're out. I think we're out and we're ready for our next phase in our life.
Yeah.
Something about estrogen, though, is people that have low estrogen, they are at risk for osteoporosis.
Big time.
This also could be an age-related type of disease, but we want people low in estrogen for a long period of time. We're worried about osteoporosis. We're worried about cardiovascular disease. We're worried about
hair
loss, eczema flare-ups, psoriasis flare-ups that you never even knew you had. We're worried about just feeling normal, just feeling like the best.
And mentally and emotionally.
If we've ruled out disease, we know that if this is an estrogen, all these symptoms are from the loss of estrogen.
Okay, so how Because I've heard mixed reviews on this about getting your estrogen tested.
Sure. If you came to me and you wanted your estrogen tested, I would do pretty much what you would want me to do. But as a women's health nurse practitioner, and I'm pretty sure a lot of my gynecology colleagues will also tell, and primary care,
Yeah.
would probably say it's a waste of. We're not treating labs, we're treating symptoms. And how bad are those symptoms to you to want to get your labs drawn? Because in different times of the day, we'll just say just different times of the day, your labs can be everywhere.
Right.
Your heart rate's everywhere. Like, I go boom, and all of a sudden your heart rate's up. We don't need to have labs to say you're in perimenopause.
Right.
What I need to hear,
it's more symptoms.
What I have to hear from you is that these are my symptoms. Let's rule out disease and let's figure out this normal natural process that's going on. It's unique to every patient, and it just depends on what you want, what you and your provider go over and say, hey, like, I'm sick of feeling like I want to punch my husband's throat out every time he tells me that he's not going to do the dishes. Or your 5-year-old tells you no, that they're not going to pick up their, I don't know, their little toy, and you get mad over spilt milk. It's just ridiculous.
That maybe happened to you today?
Not today, but oh yeah, it's happened. Just having these weird crying spells, and I don't know, having what a lot of comments to me, that a lot of symptoms that patients tell me as the vagina. My vagina feels like it just hurts. Like when I'm walking, I don't understand. It feels itchy. Like, we've done all your lab, or we've done all your cultures. We've tested you for yeast, bacteria vaginosis, all the typical things that would cause that pain. And we don't find anything. And we try the estrogen vaginal cream, and all of a sudden, within, I would say, 2 weeks, even a couple of days, but within 2 weeks,
couple weeks for sure,
we're seeing symptom relief. Yeah. And that's just vagina problems. But also, if we were going to do a systemic estrogen, that will help with our mood. That will help with reducing our risk for dementia, reducing our risk for osteoporosis, just cardiovascular. We have new studies on the positives of estrogen,
right?
Instead of the scary studies that were misinterpreted, that were not even done on the right population.
And that's what has scared us.
And that's what
providers about prescribing, and people talking about being on HRT, hormone replacement therapy, right?
Yes.
And people are terrified of it.
People are terrified. They did not want breast cancer.
Right. But guess what? You, even having breast cancer, can still have HRT.
Yeah.
And it's amazing.
And it is life-changing.
Right.
It's life-changing.
Right.
It's a new, I think, opening for women, for trans men even. It's an awakening that we don't to these risk factors. We're actually 1 in 8 women will have breast cancer in our lifetime. We just know that. But that's like an age-related disease. That's not caused by these hormones. What we're dying of is cardiovascular. What we are dying of is osteoporosis from falling.
Yeah.
And we know that it's from lack of, not just total, there's more to it, but there's just with a little bit of estrogen. Mm-hmm. And there's not a timeline for how long you can have this estrogen. Like, we're seeing positive effects.
So here's my real question. How soon can you start it? When is it appropriate? Because all of these things that I'm reading, I'm like, sign me up. I can really bring it on.
So it
goes back to symptoms.
And you'll go into your provider, you'll talk about your symptoms. And I would say most women, if they would like to try estrogen, we would start it. And you didn't have any underlying medical complications, we would just start it. The new research and what I read recently was that if you're wanting to do systemic estrogen, the patch is the best and the lowest risk.
And you just put the patch on.
You just put the patch on.
And how long do you have to change it?
It depends on the dose.
Okay.
Depends on the dose and what you need. And here's the other thing is that we don't just give you estrogen. Estrogen and progesterone are best friends.
Yeah. Yeah, let's talk about progesterone too.
So if you have a uterus, we will be giving you progesterone, because just giving you estrogen alone can cause you to have infertility, can cause some other symptoms that we are not. And so if you have a uterus, we will be giving you low dose progesterone. Progesterone will help with that sleep. Progesterone will just help make sure that lining in your uterus is shed off and we're not building up that endometrium.
Right.
And when we're talking about these hormone therapy, so this is estrogen and progesterone together, we're not talking about large doses.
Right.
Some women don't even notice the effect, and we need to increase the dose. This is not a birth control pill, even though we can use birth control pills. This is like a low dose. Your body doesn't even make this lowest dose. It's a trial and error, and everybody's body needs processes differently, and we just need to see how it goes and give it just like any medication. You're going to give it 4 to 8 weeks and see how you're doing it. Hate it? It's not improving your life, then get off of it.
Or talk about
or other
modifying the dose.
Right? Modifying the dose, changing the dose.
But the truth is, and what you're saying is that estrogen and progesterone they're buddies. They got to work together.
They're buddies. Yes, they are buddies.
For most of the time.
For most of the time.
Yeah. Okay, so there's this other hormone, testosterone.
Dun, dun, dun.
I'm just saying, women have testosterone too.
We do.
Yes. Tell me.
So women have testosterone too. So this helps us with our libido.
Yeah, it does.
So if anyone's ever been pregnant and then they've had a baby and they're breastfeeding, they might notice that they don't have a libido. Or this could be for many reasons, like they're having to do everything. But anyways, we won't get into this. So
for another episode.
It could be we're just our testosterone's low. When we work out and we have muscle mass, that's testosterone. Bone health, it's part of testosterone. Let's see, testosterone also helps us have just our bone structure. That's why it helps with bones. I'm just going to say that. It helps with a lot of other things, but yeah, it's part of us and it's what we need. So a lot of women that are having sexual dysfunction because of low libido, we can give testosterone to. Even breast cancer survivors, we can give testosterone. And it's wonky with the way that the FDA has approved testosterone, and it's not getting testosterone like in the high doses that a male would use for building muscle, just giving low doses. And that is an option.
Literally can be a game changer for people.
Literally can be a game changer.
And everything from taking it more systemically or just even the little cream.
A little cream is what I have most experience with.
Yeah.
And yes, it can be a game changer.
So I have a couple patients who have been prescribed this cream, and they'll even just put it on their clitoris just for like fun. And just how it changes their entire world. Lima's Pharmacy does make a little scream cream. You don't need a prescription for it. You can just go in and get it. And there is, I think, a tiny bit of testosterone in there. And the whole idea is just, if you can buy it over the counter, we're not too worried about it. But just to give a little get up and go. That's what it is.
I hear that.
Okay, so we have testosterone that helps with libido. Progesterone and estrogen buddies to help with systemic effects of menopause. What else do we need to know? Menopause.
I want to go back to perimenopause a little bit. So perimenopause can be like 8 years long before you hit menopause. So you can be dealing with some odd symptoms for 8 years and not really know what's going on with your body. So just make sure you talk to your provider and start making a little bit of changes to your life.
Like what? What kind of changes do I need to be making right now?
Right now, we'll just start mapping your period.
Okay. Easy.
Just easy, basic. Just start mapping your period. They have tons of apps online that you could do. Just map your period and map your symptoms with your maybe a week before my period. Oh gosh, that's really the irritating time in my life where I probably just want to go and be alone in the Bahamas somewhere.
Pick me up once a month.
Or maybe like a couple of days before your period, you're like, oh my gosh, I have this tremendous headache and I can't even function right
Yeah,
now.
headaches are a big one.
Or maybe it's how long your period is lasting and how much is your period.
Right.
And that would be very helpful for your provider when you're letting them know this is what's going on with your period. That would be like the first start. Another start would be just try to start moving your body. Thinking about weight bearing exercises, start thinking about instead of when you're at the co-op shopping or the grocery store shopping, instead of parking front row, like maybe try to go back a little bit, do a few extra steps, maybe circle the outside of the grocery store a few times. Just think about moving your body. And another thing that you might want to look into is some supplements.
Yeah. Give me a little supplement list here.
So everyone's different. Everybody's needs are different, but I think a good, healthy supplement to take would be some sort of probiotic.
I talk about probiotics with all my patients.
Either you can do vaginal probiotics, you can do oral probiotics. Can't give a brand name, but just look into them.
Yeah.
See how they make your body feel.
And there's so many different ones.
And there's so many different ones. Refrigerated, non-refrigerated.
Yeah, oh gosh, they're all over.
Even just eating yogurt.
Yeah.
Have tons of yogurt. Just eat yogurt.
Natural products too.
Great
Definitely.
protein. So that's another good one. Nutrition, increasing your protein.
Okay, so I'm hearing all these fun things about how much protein we really should be eating and when we should be eating it based on exercise. So I really haven't dove into the literature yet.
So much research out there.
Yes.
Good and bad research.
Fair.
Who's putting it out? We don't know. We know protein is important.
Yeah.
Especially for perimenopause, post-menopause. Everybody needs protein. The current one that I read about was 100 milligrams a day.
Okay.
I don't know how many pieces of chicken that is, but that's a lot.
It's so much.
And then I think of protein, oh my gosh, constipation.
Depending on what kind of protein you're eating.
So that's what I haven't read much of the research, but I know we need protein and I know we need fiber.
Yeah.
And we need water.
Yeah. Yep. Yep. And so the current research that I read was especially women in this perimenopause phase need to be having up to 30 grams of protein 30 minutes after exercise to gain the maximum effects of the protein and exercise. So that's hard.
That's really hard.
It's really hard. And that's where sometimes they have some good bars and things like that. But then what else are you getting with the bars? You're getting the sugar with the bars sometimes. But some of them are really good and have fiber and do all of the thing. But so just things to start paying attention to.
Things to start, just your diet.
Yeah. Okay. So protein, exercise, fiber, water.
Let's see what else. I also say calcium.
Yes.
For osteoporosis.
Yes. And hopefully you're getting a lot of that within your diet.
Hopefully, like almonds are a good source of calcium. You have to eat a lot. Parmesan cheese is a really good calcium source.
There we go.
If you're eating that yogurt, you'll get yogurt. You'll get You'll get your probiotics. You'll get protein, and you'll get some of your calcium.
It's not even a twofer; it's a threefer.
Just really, maybe just even a multivitamin. Just to try to start giving yourself the nutrients.
What about maca?
There's research in it for sure.
Okay.
I don't.
Okay. Just checking. People are talking about it. People are talking about it. So from a physical.
Try it. I think it's not going to kill you. And try it. If it works for you.
Also, that's what's important.
I believe in placebo effect of things. If something works for you and it makes you feel good, then do it.
100%.
If it doesn't make you feel good, then stop it.
Yep. It's trial and error.
It's trial and error. And it's your body and your body's unique. Like every individual, your needs are different. Just try it. But
we love hearing this from a provider.
Definitely.
There's not universal medicine that just should help
It should be eco medicine or ecosystem. I think it's called like ecosystem medicine.
We love it. Yeah.
Try to eat good quality food.
Yeah.
Try to eat whole food. Take some vitamins. If they work, if they don't, then.
And get your body moving.
That's, I think, just getting your body moving.
So from a physical therapy standpoint, it's also important. And what they're saying, especially in this perimenopause, menopause stage, is lifting weights.
Absolutely.
And lifting heavy weights. So it used to be that we were just like, oh, we're so worried about bulking up. No, you're not. Don't worry. Unless you're like a crazy superhuman, you're not going to go crazy with it. But push yourself to lift some of those healthy weights in a safe environment. Come ask your personal trainer, ask your physical therapist to help you with a program. There's some great programs online, but the idea is lifting heavy weights is going to help change with osteoporosis, even cardiovascular benefits, all of these different things that can circulation. Yeah. That can be affecting you during this phase more times than in other times in your life.
You read about protein after you work out.
30 minutes. 30 minutes. Eat that protein.
See, I remember in the morning, you're supposed to eat about, I don't know how many grams, but
yeah. How many eggs did you eat this morning?
Yeah. Chickens didn't really lay them all, so I didn't get all the ones I wanted. So one. Yeah. But eating healthy protein, lean protein, and starting your day off right with breakfast.
Yeah.
Talking to your friends.
Oh.
Talking to your mom and your aunties is another one, because a lot of menopause, you tend to follow what your family has, what your mother has experienced. So if your mother experienced menopause at 48, you might be getting close to that. If you smoke, that's another thing. They say that huge risk factor for multiple things. You will experience menopause 2 years earlier than most women
if you smoke.
If you're a smoker.
So
trying, if you can, to stop smoking the best you can.
Yeah.
And getting help with that. A lot of mindful meditation has been helping with cessation of smoking as an option. But just, think about that. Also fatty foods. Also alcohol. We didn't talk about that. Oh God.
Oh, do we have to?
But alcohol, you might notice you have less and less of a tolerance as you start to age.
For sure.
That's a huge one. And to try to reduce your alcohol consumption is a good one to do. Trying to think of things I missed. I have so much in my brain that
I love it.
I don't even know how to get it out. I just don't know how to say it.
It's just a wealth of knowledge.
I do want to say that in the medical community, we do say that when you have missed your period for 12 consecutive months, you've had no period, no bleeding whatsoever, that's when you've reached menopause.
That's the start of menopause.
You've reached menopause.
Okay, you're officially menopausal.
You're officially menopausal. You have not had your period for 12 months. And there's no underlying medical condition. You're not in any treatments that are going to stop it. You don't have any underlying disease. You have not had a period
for 12 months.
You're in menopause.
Okay.
Now, all of a sudden, now you're considered post. So really, menopause is just...
It's a date.
It's a date. Your last menstrual period is, 12 consecutive months of no period. Then you can be considered menopause.
Okay.
They considered you went through menopause. Leading up to that, your wild periods, your wild experience, your wild journey, it's maybe wild. It might be completely, you're fine with it. That is perimenopause. Generally, most of us reach menopause 51 to 52. That's just an average. You could be earlier. You can be as late as 60 years old. But generally, most women reach it about 51.
Yeah.
And something else that I'd like to mention that I forgot about perimenopause, you are still fertile.
Oh, yeah.
You still need contraception.
Yeah. And that is important to bring.
Even though your eggs are like going and ready to retire, there is still a chance that you can become pregnant. And if that's something that you're not excited about, you should definitely talk to your provider about that, because you can become pregnant, and you can become pregnant at 48. It's so rare, like 1%, but it can happen.
Mm-hmm.
So just be mindful of that. And also be mindful if you are using lubrication, if you're using an oil-based lubrication and a natural oil-based lubrication, like coconut oil, which is my favorite, it can break through condoms.
Yeah.
So just if you're using condoms, as everyone uses condoms because we're preventing HIV and STIs.
All of the things.
Of course. Not just pregnancy. Of course we're using condoms.
All the time.
If you're using coconut oil as a lubricant, just be aware that
It can break through.
It can break. So just be mindful that even though maybe you've missed your period it's been 4 months and you haven't had your period and you're used to having a period every month, you can still become pregnant. So just be mindful. That's why circling back to calendar, your menstrual period.
Okay.
Just start keeping track of that. Actually, every female
should just in general.
Like as soon as our daughters or our people starting their menstrual cycle, we should just start taking track. Be mindful of our body and the different changes that we have.
Yeah, it's important. And the different mucosa and how do your bowels change during the different times of the month? All of these things are totally affected because of those beautiful hormones. What else? What else?
I don't
Anything
know.
else? Get all the high points?
I think I got all my tips. I know there's more and I'm missing it. All inclusive, the regular exercise.
Yeah.
We talked about getting your labs done. So we did talk about labs. And so the once a year recommendation for women to go get a well women's exam, just to talk to your provider about how you're feeling, but also to just get your labs. Maybe you haven't had your labs since you had a baby, or just you've been a healthy person and you're 40 and you've never had labs done. Let's just get a baseline. Let's just get a base cholesterol. Let's just get a basic thyroid just to see. And these are with insurance and without insurance, they're pretty minimal cost.
Yeah.
And there's certain labs that we could do that could tell us about metabolic disorders, could tell us about thyroid disorders. So it's just important to see your provider once a year.
Yeah.
Just check in.
Yeah. I love that advice. Absolutely love it. This has been a wealth of knowledge. You are the best. We really appreciate it. Thank you so much.
Thank you for listening, and if you know someone who would benefit from this episode, please share. If you want to get updated on new episodes, hit that subscribe or follow button wherever you are listening. And until next time, keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.